to the judges in the front row, and thank you all for being here this evening.
In addition to this, we offer certificate courses. We will provide that information as well. So, every year, College of Pharmacy conducts a conference, and this is our 6th annual conference. As you know, the theme is disorders and update. It's a very relevant theme today because we find that many of us suffer with respiratory disorders. Almost, I would say, every third person you will hear him coughing, sneezing, etc. So it's very relevant today. And as community pharmacists, what you can do, that will be taken up during this particular conference. As I mentioned, respiratory infections and chronic respiratory diseases are among the most common reasons that patients visit primary health care centers.
We are very happy to have him. He is Chief of Pharmacy and Head Clinical Support Services at the Al Jalila Children's Specialty Hospital in Dubai, UAE.
Assalamu alaikum. Good morning, everybody. First of all, I would like to thank, my name is Awad Umar, I'm Chief of Pharmacy Department and Director or Head of Clinical Support Service in your hospital. It's an emerging hospital trained because it will keep the body doing the right things, the right time, and don't fill your stomach so you affect the diaphragm and you affect the cavity of the chest, and then you put pressure on the lung. So when you are moderately eating, your respiratory system will function well. So always you don't have something pushing the diaphragm up, affecting the effects of the heart or affecting the lung, or at least the cavity volume of the respiration, which was you're giving like
Enlightening presentation. Dr. Awad has given us a good overview on respiratory tract diseases, and now the floor is open for any questions you may wish to ask. We can permit about 2
I want to ask something, encourage fluid intake, especially early morning, because it will give mucus more liquid, and so it will be easy to spit it out or coming out.
Yeah.
That's all. Thank you.
Calyptus inhalation can do many things to help you using the respirator.
But from my experience, putting specialty
Yeah.
early morning and almost having like pneumonia, it helps a lot.
Correct.
Yeah.
We're talking about future about the technology, the really future prospect. Conventional label system or conventional aerosol, in the beginning aerosol is composed of systems that depend on compressed air or liquefied gas to expel the content present inside the container. And to be more accurate and to deliver accurate doses, the aerosol or the pharmaceutical aerosol is better to be supplied with metal bulb. This metal bulb allows delivery of certain amount. It means liquefied gas. So drug is either soluble or insoluble in the solvent, or the solvent will develop mixture. And by actuation of the aerosol, the patient can take the dose. Dose is mostly meter.
Why no need for synchronization breathing with the actuation?
Because it is designed in certain, the mouthpiece is inside the mouth, and once the breath happen after 1 second, 2 seconds, the mist of aerosol will reach the lung. Because it is not sprayed like a gun or fast. It is sprayed like a nebulizer. So it is available. It will be available inside the lungs. Okay? But
You said it's not recommended for smoking people, so why it is so?
those who smoke.
Aphasia is not also
Prospects of FEG in the treatment of diabetes, that is the main stumble block in the delivery of insulin, not by IV route. It is going to be immense help to the mankind. Everybody doesn't like much of a pinprick each and after every meal. What is the future prospects of FEG in delivery of insulin?
that is inhalation. Inhalation is one of them, like aphasia, and also oral, nasal. That is the main routes that they are trying to deliver insulin through that. One of them is successful, but the other is very challenging because insulin is not stable in the stomach, not stable in small intestine, stable only in the colon. So it couldn't be taken orally. Even in the colon, it is stable, okay, there is no enzyme to degrade insulin, but still absorbed.
How do you comment on is it able to tell you the exact requirement of the insulin for the patient? Because the aphasia isn't, delving the exact need of the insulin requirement for the patient. Because I also came across a study where they say that aphasia has not been so widely used because the exact demand is not met.
Very small, they can formulate I think they can formulate larger dose to be delivered accurately to the lung and to be absorbed. So it could be used but as adjuvant or as helper to the injection insulin. It's not successful on 100%. So they don't want the patient to depend mainly on it. Otherwise it will be fatal if it is not accurate.
Ibrahim, for such an interesting talk. A hospital in Nigeria prior to joining the hospital in Gulf Medical University.
A great pandemic. Although smoking is considered a lifestyle rather than a disease in the current situation, but it is indeed a pandemic disease. Now, about a century ago, in 1900s, the annual consumption of sticks was about 50 billion. And if you look at the consumption of sticks in 2002, it's inched up to 5,600 billion. And it's going to increase in the next 15 years, 15-20 years, it's going to double. So this shows that even though there is immense effects, hazards of smoking, the practices are still continuing, and the amount of a person who is more or less willing to quit, you have to assist him. You have to assist him in quitting by using counseling, pharmacotherapy, and social support. Once you have prescribed a treatment, either it's only counseling or a medicine, you have to assist for a follow-up. This could be a physical follow-up, where you can ask a person to come once in a week or once in 2 weeks, or it could be a repeat telephonic conversation, so that the person is kept in the loop and he is not lost. The reason it is important is because nicotine is an addiction, and if a person is not kept in close follow-up, there is very high chance that he will go back to smoking.
We've learned from this today and be able to spread the message and our commitment to wipe out smoking. I was just wondering.
Of smoking cessation team. In fact, I'm surprised that in our hospital we don't have a smoking cessation clinic. It is always better to have a clinic where we address this problem specifically rather than in the routine OPD. And yes, a psychologist will help. There is also a role of antidepressants such as some of the antidepressants which are used for depression are also used for smoking cessation, because it is not only the addiction, it is also the psychological.
Is there any side effects for Champix? Any side effects for Champix?
Side effect of?
Champix.
Okay, side effects are very mild, which are very common with other drugs also. Mainly nausea, dizziness, sometimes irritability. The bupropion, the major side effect is occurrence of seizures, and therefore if a person has history of epilepsy or has had a head trauma or a head injury or a head neurosurgery, we should avoid. But
we know that there is a molecule called as the rimonabant. It was introduced by Sanofi, and it has been withdrawn from obesity. Now they are in the clinical trial for smoking cessation. So it is report something like when it is stimulate the receptor to release dopamine, and withdrawal symptoms will be very high. So what about this efficacy and withdrawal symptoms for the varenicline?
See, the beauty of varenicline release dopamine, and therefore it maintains the level of dopamine in the brain, which otherwise will not happen if a person immediately stops smoking. So therefore, in the absence of nicotine, it still maintains the level of dopamine and prevents the withdrawal symptom. And in the presence of nicotine, since it is blocking the receptor, it blocks the reward that the nicotine gets. So from the molecular action point of view, there is a good evidence that it should reduce the withdrawal, and that is why the abstinence rates are high. But
risk factors which is taking place with it.
It's a very good question. In fact, as I mentioned, in UAE, in about 2010, they made a legislation where they started, that is when they started awakening to the effects of smoking. At that time, the legislation was basically to prevent the import of cigarettes without a certain standard. So they wanted to say that only those cigarettes with some good standard should be imported to the country. That was in 2010. In 2014, they started thinking in terms of banning smoking in public places. There is establishments in UAE, they have banned smoking in public spaces. Now, along with this initiative, the UAE government also plans to set up in those centers people are trained. As of now, I am not aware of any particular hospital running a clinic, but I am sure there will be. I am not aware, I am new to this place. But the government
propagating in respiratory society, we need to implement this withdrawal in the insurance because 90% of our patients are insured. And for one packet of cigarettes about from 10 dirhams to 40 dirhams, it's a chunks, it's costs about 300.
Ladies and gentlemen, my request delegates to kindly be seated. I know an announcement of tea break would always tempt you to all of involved, but just be with us for a few minutes. My name is Ravi. It's my pleasure to welcome you all formally on behalf of the founder president of this institution, Mr. Tubey Moideen, and the academic leadership.
مدادا لكلمات ربي لنجد البحر قبل أن تنفذ كلمات ربي ولو جئنا
many farms. So I welcome Dr. Kishore here amongst you and introduce the speaker, Dr. Muhammad Al-Mansouri. He's a specialist here in Chest Disease and Critical Care Center, GMC. We have a very experienced and a very professional physician who is going to talk about this role of antibiotics in the treatment of respiratory.
Which antibiotic will be provided, different guidelines for antibiotic selection, and lastly will be respiratory disorders. We have to direct therapy either for what is the most likely organism and what is clinical.
When I come across the CAP, community-acquired pneumonias, I would like to share your experience regarding the first line of antibiotic. You go for this levoflox. If it is, what is the dose? You go weight-wise, or 750 mg or 500 mg, and OD dose for 5 to 7 days. That is how I want to share your clinical experience.
What experience? Respect to which organism? See, I have a patient coming with high fever, but dry sputum is no sputum production, and X-ray showing feeling in both sides. So what is the most probable organism I will what is I am suspecting from this patient? Either viral or atypical. Okay? think we can.
And now we are always in a
This is
we are
situation.
compelled to give antibiotics. This is a fact which is true. My question is, how is the practice of pharmacy can improve, and how can they contribute to the development of resistance, and how can they minimize resistance? What is their decision, and what should the community pharmacists do in such critical situations?
In a healthy person, only 1%, but if the person is already having asthma, chances of getting asthmatic attack with aspirin is 20%, very high. Other NSAIDs can also trigger, asthma. Bronchospasm is one of the most common drug-induced pulmonary problem, and it is very non-specific, cholinergic or.
So it is ideally to be avoided in patients with asthma. All beta.
I would like to discuss about the introduction, epidemiology, the pathophysiology, presentation, and then I will move to management so that we will have some basics regarding that. And then I will move to the role of pharmacist. In fact, in the management of pulmonary embolism, the role of pharmacist is very important. Because the drugs which we are using in the treatment of pulmonary embolism has a lot of contraindications. It has many of the usage issues, there are a lot of drug interactions. And then most important is the patient education part also. So we are going to look into that also at that end. So when I say about pulmonary embolism, when you listen about pulmonary embolism, it is a disease which doesn't occur as single. It is many a time.
And the thrombosis. And what is the thrombosis? The same treatment?
No. It is causing a clot
by a patient. So before that, I would just like to give just a brief idea about what pharmaceutical care is. I hope all of you know already. So pharmaceutical care basically is the responsible provision of medication therapy. Responsible provision. Pharmacists are responsible for the therapeutic efficacy. Pharmacist is responsible for its safety. Pharmacist is responsible for efficacy. These two things are very important. Pharmacists play an important role, and especially it's very true with asthma disease. Okay, you know that there is a lot of problem with asthma. You know that most of the patients, asthma management. The very important part is the triggers. Patients are not aware about the triggers, so it's important for pharmacists to take an appropriate history, a very patient-specific history, and identify the trigger factors. And it's very important for them to find out about their medication practice. Many of the patients take medications without knowing what it is meant for. They do not know procedures to use these particular. We have many devices that's available for asthma patient. Okay, like especially inhalers, we have meter dose inhalers, we have rotahalers, and there are something called as peak expiratory flow meters as a professional healthcare team member. So medication reconciliation will help the physician to understand about the patient. The patient has been taking throughout this history. And later, we can refer the patient to the physician in an appropriate way in the clinical knowledge. We have to mention about the clinical status, the compliance level, the history of the medication the patient is already taking on. Following which we have the therapy monitoring is through empowering the patient to self-monitor.
And severe stomach irritation, and because of this breathing problem at night, I can't sleep the whole night, and then in the morning I have to get up early for my work, everything, and sleeping is so important.
Yes, I understand. So you've just experienced breathing problem, you have cough and stomach irritation, right?
Yes.
Can you explain what you experience when you have this breathlessness, any pain, any sound?
I have severe throat pain, and while breathing I have whistling, I can hear whistling sound, and just that I have a lot of pain.
Okay, you have whistling sound and you have pain in your throat.
Yeah.
Since when have you been experiencing this?
Since this last week, the whole week I have been experiencing.
Okay, since last week. Did this happen before also?
No, not before. It was last week was severe. The whole time I couldn't sleep, and at night I usually have suffocation, and I have to open windows so that I can sleep properly.
Okay, so you feel suffocated.
Yes.
Okay, so Ms. Rizwan, other than your breathing problem, did the doctor ever tell you if you have any other high blood pressure or any
Yes, my family doctor had said me that I have high blood pressure.
High blood pressure.
Yeah.
Since when?
It's about 3 years ago. I had high blood pressure and this bleeding problem was.
Breathing problem.
Yeah.
So it was together since 3 years.
Together.
Anything else? No other problem?
No other.
Okay, fine. I'd like to ask you some questions about your family. Does anyone in your family suffer from similar condition?
My father has high BP and my mother is having sugar problem.
Sugar.
It's a very big family, so I don't know who all are having anything.
Yes,
I just know my father.
I understand. Can you remember, have you ever experienced that your breathing problem or your cough got worse?
Yes, especially the flowering season. It's worse. I can't work in the flowering season. Someone else has to work or my father has to work. So I don't work in the flowering season.
Only during the flowering season?
I can't help it.
What happens during the flowering season if you have to work by any chance?
Severe irritation, I can't breathe properly, continuous cough. So I don't stay there. So I have to go inside and work.
Irritation in your throat, right?
Yes.
Okay, you have severe irritation and you can't breathe and you have cough problem. Okay. Are you exposed to any kind of cigarette smoking? Maybe your family member or your friends they smoke?
Yes, my father is a...
So when he smokes around you, do you feel any irritation in your throat, any breathing problem?
Yes, severe irritation. I start coughing also, I have a lot of breathing problems. So my father and me can't stay in the same room when he smokes. I have to go out or whether he has to go out.
And the similar is when you go out with your friends?
Yes, I go out usually when I'm with my friends.
Okay, fine, you just leave. Yeah. Okay, Mr. Rao. Other than this, have you been allergic to any food?
No allergy to foods.
Any drug?
I had an allergy to a drug. It was for my throat infection. I just took one tablet and I was straight away in the emergency department. I can't remember the name.
Can you describe what happened after you took that tablet?
I had a severe rash, irritation all over my body, and it was burning. The whole body was burning, and I got admitted straight away.
What was the drug given to you for?
Throat infection.
Throat infection. Okay.
I was hoping that I should have just gotten throat infection and not taken that tablet.
I'm really sorry to see that. I'm really sorry. Was it by any chance penicillin?
Yes, it is penicillin, yeah.
Okay, it was
just don't take that penicillin.
Yes, we'll make sure we don't.
Fridays we eat mutton biryani. So, who can eat vegetables every day?
Yes. So you usually eat mutton?
Yeah.
Okay.
Biryani.
Do you have any pets at home? And do you know any allergies to any animals you have?
No, I don't have any allergies to pets. But I have a pet cat, Fluffy.
Okay.
No allergies. He's good.
So when you play with your pet, you don't experience anything?
Yeah, I do experience a lot of irritation and breathlessness. Nothing special. Yeah. Okay.
And then if any lifestyle changes are required, okay? So first I'll be talking to you about your disease. It's basically called asthma. It affects your breathing. Okay. This is the airway. So in normal people, it's basically open. In asthmatic patient, it is a bit narrower. So that's what you have. It can cause breathing problem, as you told me, you have breathlessness, right?
Yes.
And it can cause severe coughing and maybe chest tightness. There are many factors that can worsen the symptoms. Especially, you told me that your dad smokes, right?
Yes.
That is one of the reasons your symptoms got worse. And your friends, you work at the farm, and especially during the flowering season, your symptoms get worse, right?
Yes.
So that is one of the main reasons that your symptoms that you're experiencing this now. And you have high blood pressure, right? This is only once daily. This you can take in morning after your food. Okay? And your NDI, the sprays you told me about, you told that it doesn't help you. This is called a metered dose inhaler. The dose is already metered, it is already set according to the requirement you need. Okay? Okay. The dose is already set over, you can see over here. So I'll show you, I'll teach you how to
I have to set the dose.
The pharmacist can set and give it to you, or if there's any change, you can go back to the pharmacy and then we can ask. Okay? Okay, so I'll show you how to use it, fine?
Fine.
This is called the canister. This contains the medication. This is the cover. This is the mouthpiece, and this is the body. So first you have to remove the mouthpiece.
Yeah.
This medication is called salbutamol. It basically opens up your airways while you have breathing problem. So first you have to take this medication, okay?
First?
Yeah, salbutamol first. Yes. Salbutamol is first. It says twice daily, 2 puffs. So one morning, one at night. Since you told me your breathlessness increases more at night, right?
Yes. I just say take it at night then?
But according to your prescription, it says twice daily. So you can take once in the morning, once at night. Okay? 2 puffs. So you have to remove the cover, shake the medication. This is the mouthpiece. Okay? You have to put it between your teeth.
Oh, okay.
Okay, and then you close it tightly. Fine. And then you press this canister. This is the water which contains the medication. You press it. Before putting this, first you breathe out, and then you put it between your teeth. You close it tightly. Okay. Then you press this once. While pressing it, you inhale. You breathe in deeply. Okay. Just while pressing this, so that the medication can go inside your lungs. Okay.
Okay, I didn't do this. Hard.
Yes.
That was easy.
So you have to breathe in while you press this, and then hold your breath for about 10 to 20 seconds. You can count from 1 to 10 as long as possible, maximum of 20 seconds. Okay? Okay, then.
And I hope it was very useful for you. So you can collect your certificates right now in the hall. Please don't get up, you can sit there about the certificates and discuss with you.